All right, we'll go ahead and get started. Hello everyone, and welcome to Isaac Health's monthly Learn at Home webinar. Today's webinar will be focused on caring for caregivers, strategies for mental well-being and support. So, for those of you that haven't met me, I'm Dr. Joel Salinas. I'm a behavioral neurologist. I'm also co-founder and chief medical officer of Isaac Health. I'm honored to be your host today. So whether you're a caregiver, a family member, a patient, or someone committed to supporting those affected by dementia, we're so glad that you're here. So this month at home is really focusing on emotional and psychological needs of caregivers who are oftentimes the unsung heroes in a dementia care journey, really supporting our loved ones who are living with dementia or other forms of cognitive impairment. Today's conversation will offer practical strategies for managing stress, caring for yourself while caring for others, and building a strong support network. I'm thrilled to be joined by two amazing guests today. We've got Adrianne DeVivo, who's Clinical Operations Manager here at Isaac Health, who brings a wealth of insight from working directly with families navigating cognitive conditions, and Marvell Adams Jr., who's CEO of the Caregiver Action Network, one of our valued partner organizations and one of the nation's leading nonprofits dedicated to improving the quality of life for caregivers. So, a bit of housekeeping before I hand it off for some further introduction. As always, we want this to be a really engaging session, so feel free to drop your questions into the Q&A box at the bottom of your Zoom screen. Just click that little button there that says Q&A or has a little question mark, and we'll be answering them towards the end of the event. So just to give Marvell and Adrian a chance to introduce themselves, maybe Adrian, why don't you tell us a little bit about kind of your experience in this area?
Hi, everybody. I'm so glad you're here tonight and that we get to spend some time together. As Joel said, my name is Adrianne DeVivo. I'm currently the manager of clinical operations here at Isaac Health. But before I landed here, I was a dementia specialist. I am a certified dementia practitioner, so I get to work one-on-one with families and caregivers because dementia is a family disease. We know that firsthand. And you guys are the true unsung heroes in the everyday battle that is dementia. I also was the director of advocacy for a large healthcare system, so I got to see firsthand just how strong some of our caregivers have to be in order to advocate for their loved ones' needs. And here at Isaac, our goal is always to make that advocacy less, so that you have to advocate less because we're providing you the resources that you need preemptively.
Wonderful, Marvell.
Hi, everyone. I'm Marvell Adams Jr. As Joel said, I am the CEO of Caregiver Action Network, which is a not-for-profit based in Washington, D.C., but our reach is national across all 50 states. I have a 20-year career background in serving older adults and those that care for them and support them. I Originally, it was a nursing home administrator many years ago, and became trained as a dementia communications coach to help really support our staff and families and really the entire circle around individuals supporting residents with cognitive impairment and dementia and Alzheimer's. And so just really excited to be here with you today to talk about this topic and also find ways that we can share knowledge and support caregivers. So thanks so much to the Isaac Health team for inviting Caregiver Action Network to join us today.
Well, we're glad to have you both here. So I think just to get started, I want to set the table a little bit just to make sure that we're on the same page. So when we say the word dementia, what we usually mean is dementia as kind of an umbrella term, kind of like how the word cancer is an umbrella term. Just like how there's many different causes of cancer, stomach cancer, breast cancer, pancreatic cancer, there's many causes of dementia, where Alzheimer's disease is just one of many different causes. You can see from the list here that includes things like vascular dementia, dementia with Lewy bodies, and all these conditions have their own specific causes. Now, when we're talking about different stages of disease, we like to think about it as a continuum. And so you've got on one end of that continuum people who may have no symptoms, but maybe there's some biological changes in the brain. If that condition starts to affect memory and thinking, but they remain pretty independent, meaning it's not impacting their day-to-day functioning, we call it mild cognitive impairment. And then once it interferes with day-to-day functioning, then we call it dementia. And dementia gets broken down into three stages: mild, moderate, and severe. And kind of the severity of the stage really depends primarily not on what we see on scans or any tests, but it's more on how things are going at home in terms of how much it's really impacting your day to day. Where in the milder stages, you might have kind of your complex kind of day to day things affected, like managing finances or running complex errands. Whereas in the severe state, that's where people are fully dependent on all their day to day functioning, not just the complex things, but even the basic things of kind of walking, getting from a bed to a chair, needing assistance with food, toileting, bathing, pretty much everything. And what's going on in the brain, um, there are changes that are going on biologically 10, sometimes even 20 years before someone develops symptoms. And so it's really important to really think about these conditions as a continuum. But if you think about it again from that kind of cancer or oncology lens, the earlier you diagnose, the earlier you get to treat, and the greater impact you get to have. Because many different measures, whether that's changes in the brain or kind of changes of amyloid plaque building up in the brain or tau protein building up in the brain, all these things kind of get worse over time. And as those biological changes get worse, we expect that one's memory and thinking are impaired more and more. There's many benefits to getting diagnosed early and getting treatment early. So one is just your ability to participate in planning for the future, but it's also now getting earlier treatment for symptoms and also the disease itself. You know, we're in a really unique time for specifically Alzheimer's disease, where we have two different treatments that actually target the biology of the disease itself, which helps to slow the condition itself. But just broadly speaking, it can help you really take on some health measures early, really understand what's going on, and really address any safety issues earlier. We really believe in a proactive approach, so that way we're ahead of things rather than managing things when they're already at a time of crisis. So at this point, I'm going to hand over to Marvell to talk a little bit about what it means to be a caregiver.
Thanks so much. Who are caregivers? Another word would be care partner, care advocate, mother, son, cousin, neighbor, really any individual. Caregiving is about humans helping other humans. And so, the term family caregiver really encompasses a vast array of individuals, family members, friends, and anyone else that's in an unpaid role. For care of a loved one. And this could be a newborn or infant that has significant health needs, or it could be a loved one with a chronic condition that is reoccurring, or even a soldier that is coming home after being wounded in the line of duty. So, many of the caregiver roles we talk about also intersect with age, meaning as an adult gets older and perhaps needing more support. Next slide. Thanks. So, caregiving by the numbers. There are over 105 million caregivers, family caregivers across the country, and this is according to a RAND study that was released last September. This is a huge amount of individuals. Over a quarter of the United States, individuals in some capacity serving as a caregiver. And this is a tremendous amount of individuals, but also just gives you the scope of caregiving across the United States and just how much it is the backbone of our care system. So when we talk about and peel away the caregivers that are supporting individuals with Alzheimer's, and so the Alzheimer's Association estimates that there's more than 6 million individuals across the United States caring for individuals or loved ones with dementia. Many times these are family care members, but it can be a whole array, as I said before, of types of individuals and individuals' intersection with that person's life that can be that caregiver. And so it gives you just the scope of the millions of individuals that can be helped by information that we're going to be sharing today. And so lastly, I just want to point out that, for Caregiver Action Network, we are the largest and direct support caregiving organization in the United States. And we have a no-cost help desk that individuals can reach out to us at caregiveraction.org. But most importantly, for today's purposes, we wanted to highlight what really is the scope of individuals reaching out to us. And so we get thousands of calls per year from individuals that are reaching out through our help desk. And the largest number of those individuals, the largest group of those individuals is coming from individuals that are supporting loved ones with some type of dementia. And so it's not only a significant disease in the sense of the scope of the United States, but the number of people that are reaching out to us perhaps surpasses other disease and condition states, and also just recognizing some of the uncertainty that goes along with having that diagnosis and a loved one trying to understand, okay, what do I do now, and how do I best support my family member or my loved one that has this disease. So, what is caregiving? And it may seem like a simple question, but it is a very, very complex role. Complex than most jobs, I would say, in my opinion. And I think if we were to try to write a job description, you'll see over the next few slides, it would be pretty significant. So, we're talking about a few different things. So, the types of support provided by caregivers, activities of daily living, or ADL, sometimes that people call it in shorthand, particularly in care organizations, but getting dressed, going to the bathroom, eating, using the bathroom, transportation is a huge part, going to doctor's appointments, the grocery store, visiting loved ones. That is a big part of support provided by caregivers. Also managing medications, and this can be really important because whether it's making sure that a loved one is taking the medications on time, the right medication, the right dosage, and making sure that an individual who may have trouble tracking and really managing their own medications has the support they need, but also recognizing that there are sometimes interactions or side effects or things that need to be done in order for that caregiver to ensure that their loved one really has the proper medications and that they would be given with compliance with the doctor's prescription. And also understanding that, managing behavioral symptoms that as a disease progresses for individuals with Alzheimer's or dementia, sometimes wandering, hallucinations, sometimes unexpected aggression or even depression become part of an individual's daily behavior. Scheduling appointments. And so, this is a big part of what caregivers do. So it's not just doctor's appointments, but treatment and therapy appointments as well, and other types of interactions that may take place inside the home or outside of the home, but needing to have some sort of coordination for that individual to be able to connect with that provider. And then also recognizing monitoring health conditions. And so, there may be times that it takes some interpretation or understanding what's going on with that loved one that's going through cognitive change. And so that caregiver many times can be the best voice to provide information to the provider, to their doctor, understanding what symptoms may be occurring, new or recurring, or also understanding what changes in medications may be taking place, or if there's side effects that are taking place from those medications, and being able to report those back and really guide the ongoing care and treatment of their loved one. So financial management, and this is another very significant part of caregiving, and it can be a rather stressful one. Paying and tracking bills, also recognizing that many times caregivers themselves spend a great deal of their own personal resources to support their family and loved ones when it comes to finances, transportation, medications, all those things do have a cost, sometimes hidden, but filling up that gas tank and being able to understand that there are financial implications of being a caregiver, but also understanding how to monitor financial accounts, as well as getting a sense of, what is it that we need to make sure of in order to keep the financial security of their loved one intact. And then also recognizing that meals is not listed as a lower priority on this list. It is very high up on the list for individuals, and understanding that not just preparing meals and shopping for food, and understanding of keeping the house kept up and throwing out expired foods, but also understanding that meal preferences may change over the course of a disease changing, and also knowing that that loved one may have trouble even verbalizing what they want to eat, and so finding ways to be able to provide options to their loved one in preparing those meals. And then talking to doctors, and this is again a very significant point of being a caregiver, because that caregiver, when it comes to supporting a loved one with Alzheimer's dementia, sometimes cannot speak for themselves, or at least share accurately what's going on. And so reporting changes in symptoms to doctors, new health issues or complications, and just making sure in conjunction with the next one, managing the care team, that caregiver is really a bridge to the provider, the doctor, the nurse practitioners, the specialists, as well as to the care team. And really, we encourage folks at Caregiver Action Network and provide them support of saying, be really, forthright about your role as a caregiver, because you really do have to provide that bridge and that voice on behalf of their loved one, but also recognizing the holistic approach that's needed in order for your loved one to receive the comprehensive support that they need. And so recognizing that you are an integral part of that care team and you are a very, very important bridge to the providers for your loved one. And then lastly, I'll mention that paid and additional support. So arranging in-home care, none of this can be done by alone. It may feel like that very often, that this is a very lonely role as a caregiver. It can be isolating, but also recognize that sometimes additional support is needed, sometimes paid, sometimes that is not something that can be afforded by the family. And so finding other resources to support the household, and then also just the coordination of those services, whether that means a loved one is going into residential care, like assisted living, or just coordinating individuals coming into the home. So, this is really just to give you a sense of the types of things or the proportion of caregivers with Alzheimer's and dementia versus caregivers with for older adults that may have different needs. And so, as you can see here, in every one of these categories, you've got a higher percentage of care needs or specific activities of daily living that caregivers of people with Alzheimer's or dementia are providing, whether that's getting in and out of bed and chairs down to dealing with incontinence. This whole spectrum of activities of daily living, we can see from this study and many others out there. That many times individuals that are caring for someone with Alzheimer's dementia have a higher prevalence of having to support that individual with their activities of daily living. And then they'll just mention that, in summation, across the United States, as I said before, more than 6 million Americans living with Alzheimer's. And across the globe, those numbers really start to multiply into the tens of millions. And as we progress as a nation, as our demographics change, more and more individuals are expected to have to be navigating Alzheimer's and dementia. And so, as the years progress, the needs for caregivers that have the information they need, the support and care for their own needs as well. And so family members and unpaid caregivers provide the majority of the support for individuals with Alzheimer's, dementia, and other needs. And then family members that have different roles, whether they're helping out as a long distance caregiver, which I've had the role of previously for my mom, or someone that is a neighbor next door that's mowing the lawn or bringing the newspaper up to the top of the steps. And then lastly, recognizing that, although 64% think caregiving is stressful, by and large, we find over and over again at Caregiver Action Network is that caregivers want to be there for their loved ones. They want to be in a supportive role. They want to see their loved one thrive and have as much independence as possible. And 93% of them say repeatedly that caregiving is a rewarding part of their life. So, what changes for the caregiver? And I think we're gonna
Yeah, we'll hand it
transition
over
over to
to,
Adrian
that's
for
right.
this next section.
I think we're all tired just thinking about all the things you just talked about, Marvel. Honestly, it's
I
so
know I
much.
am.
There is something that we don't talk about often in the caregiving space, particularly around caregiving for people who are living with dementia, and that is that it's not something you typically anticipate, right? When you're growing your family, you can anticipate that that's going to require new needs, new demands from you. When you move, we can adapt to those new norms. But when we start to caregive for somebody we love, there's all sorts of new norms that we don't necessarily have the time to prepare for. Caring for a loved one with dementia does mean establishing new routines as you and members of the care team take on additional responsibilities. And that can be uneasy at times, especially when those new norms are taking place in your everyday life, when they're happening in your home, or they're requiring you to leave the home more regularly, whether that's for doctor's appointments or physical therapy or any of those types of things. And that can be a big ask from our caregivers, is adapting to a new norm. As a beautiful dovetail to that, there's also changes in relationships. we oftentimes can feel lonely as we take on a role of being a caregiver. And that can come from people not knowing how to help us not knowing how to ask for help, some sort of breakdown in communication along the way. Oftentimes, people will say, I had someone reach out, but I didn't know what to tell them. I didn't know what I could ask them to do. So something we encourage caregivers to do, care partners to do, is to keep a running list. So when you're in the kitchen and you're thinking, gosh, I would love it if someone would help me clean out those top cabinets in here, or it would be so nice if somebody could help me clean up the yard this spring. This is a great thing to write down, whether you're writing it in your phone or on your refrigerator, whether you're keeping the list for yourself or sharing it so that other people can see the list as it's being updated. People typically want to help. Sometimes it can be challenging to ask for help, or in the heat of the moment, it can be difficult to remember what we need help with. So keeping a list can help us here. But acknowledging that across the board, changes are going to happen in our relationships. And for some folks, this is welcome changes. And for other people, this can be really challenging. And when we say changes in relationships, that doesn't stop outside of the role that you're playing with the person you love who has dementia. That role also is going to change. And this, again, can be incredibly overwhelming for some folks. There's resources and supports available, but it can be challenging to go from being an intimate partner to being a caretaker, or vice versa, being a child who's caring for a parent, and you were intermittently seeing each other, and now you're in the throes of doing everyday ADLs, taking care of brushing teeth or paying bills or managing doctor's appointments. There are big changes that can happen in how we relate to the person we're caring for who's living with dementia.
Great. Thank you, Adrienne. And so, I think one thing that can be really helpful is to think about kind of like this person-centered approach to care and caregiving. And so, what it is just really focusing on the individual, that loved one, and their specific needs. It involves really getting to know their likes, dislikes, and how to best kind of give them kind of those that kind of care as it really is tailored to them. The potential benefits there is, for the person who's living with dementia, it likely will mean that they'll have fewer dementia-related behaviors and can lower the need for medications to treat those symptoms. I mean, less boredom and feelings of helplessness can lower the chances that they'll develop agitation or irritability. Irritability is a common symptom that comes with these conditions. It can also increase levels of happiness and a sense of well-being, which is just so important, especially in the throes of a condition like this. And for a caregiver, what it can mean is becoming more confident in addressing these dementia-related kind of changes with communication and behaviors, increasing your satisfaction in kind of your role as being a caregiver, and really improving your relationship with that loved one, and can help to provide a better quality for both kind of the caregiver and the person being cared for. And so here's some kind of 5 basic strategies for person-centered care. One is use your knowledge of the person. So consider what makes the person unique, like what are their values, their beliefs, their interests, abilities, likes and dislikes, and structure your care around your knowledge of them. So for example, if you know that their hobby has always been kind of knitting, bringing that in, or painting, or if music was something that they loved, incorporate elements of music in the day-to-day. Did they love kind of feeling comfortable in kind of like big sweaters or quilts? Did they like the outdoors? So just really bringing in things that they really appreciate, and also kind of being cognizant that these kind of things that they love and their hobbies and their interests may change over time as the disease may progress. Um, the next strategy is to connect with them in the moment. So really try to see the world through their eyes. Now, this can be kind of challenging to do, but if you really kind of imagine as best as possible what it's like to kind of uh, be in their position, see what they see, think what they think, feel what they feel. This can help you to understand what their point of view is. And it can help to really accept their reality, which may be very, very different from yours. That includes people who are experiencing delusions. Delusions are where your brain is telling you that reality is different from what it actually is. So like paranoid delusions, something that can happen. So it can be like a heightened sense of fear, or kind of a belief that someone's stealing from you, or a common delusion is a delusion of infidelity. So just really putting yourself in their shoes to really help to understand kind of how drastically that reality has changed can help you to accept those changes a little bit better and to manage the distress that can come from them. And as the disease progresses, really focusing on feelings rather than facts. If there's a topic that bothers or upsets them, switch to a different one. You can take a yes and approach, which is something that gets taught in kind of improv all the time, which is rather than kind of saying, no, but you got that wrong, or no, actually you should do this, really think about like yes and you can move on. And some people also talk about kind of choosing your battles, like really figuring out when do you really kind of try to correct the person versus just letting certain things slide because it'll help to keep the peace. The next strategy is to choose meaningful activities for your loved one. So, when deciding what to do, really make sure that the activity has meaning and purpose for your loved one. Offer choices. This helps them feel really loved and feel respected. So that way they have a better sense of control in their day to day. Know that that loved one feel joy, can feel comfort, and can feel meaning even when dementia is advanced. And it does help to go with the flow. As I was saying, you don't need to plan every single activity ahead of time. And the next strategy is to focus on supportive relationships. So think about choice and flexibility instead of how much you can do in a single day. Some of us kind of cope with stress and kind of somebody that is a loved one that is ill by overcompensating or over functioning, some people call it. So creating itineraries and agendas and getting everything lined up. But getting really stuck on the structure of these day-to-days can actually cause a lot of distress in and of itself. So being flexible can be really helpful. Also pay attention to what's happening with your loved one in any particular moment. Maybe, there's the temperature is off and just kind of adjusting the temperature of the room can be really helpful. Or maybe there's some kind of sound or somebody around that's causing some discomfort and making an adjustment there can be really helpful. And encourage independence as much as you can. Do activities with them rather than for them. Can help them feel much more respected and feel like their life is as it has been. There's this expression I've used before that as the disease progresses, you are kind of learning to understand and appreciate this new version of yourself or this new version of your loved one and really embracing those changes that they come up. You might not appreciate all those changes, certainly, but there may be some changes that you can appreciate. You can find a place where it fits within your life and give it meaning. And then the next strategy is to create a supportive environment. Really create a space for yourself where you can talk with your loved one about kind of, what a supportive environment looks and feels like to them. Maybe it's kind of a lot of energy, kind of light and bright tones in the physically in the space, loud noises, or having people around. But for other people, it might be a quiet space with kind of decreased sensory information. You also want to be cognizant of changes in the home that can help to increase safety. So we talk about things like making sure that there are no low-lying tables, making sure that there's no rugs that can slip, thinking about where they'd be good to have some kind of rails placed to help to improve that ability to walk independently. It can be nice to keep favorite items where that person can easily see them. That can include things like photos of loved ones. It can include kind of items like wedding photos, anything that can help to create a sense of comfort and familiarity and can create help to kind of engender this kind of atmosphere that is calm and soothing. So overstimulation can make any of us feel really, really tense, and that can make it much more likely that we become more irritable or it can be harder to really kind of self-soothe ourselves with the capacity that we're able to. And this next point is really important, which is to really take care of yourself. Ask friends and family for help when you need it. It's really important to take care of yourself because it can affect your health and your ability to care for others. You've probably heard about the kind of oxygen mask on the plane analogy, which is you just like when you are on a plane and they tell you first place the oxygen mask on yourself before you put it on somebody else. It's very true. If you're not able to care for yourself, it'll become much, much harder for you to be able to care for a loved one. And so to do that, you want to build a support team. A team can help you get more done in each day. It can help you kind of stay active in your own life and take care of yourself, can help to lower kind of stress for yourself, and can give you a team to step in whenever you need help in the case of an emergency. Um, in that support team, think about who you trust and can rely on. Different members of kind of your life can play different roles. Some people can be there to kind of be an extra hand for kind of just watching. Others can be there to help with more specific tasks. And that team can change over time as the disease progresses. Not everybody is really able or willing to be able to help with things like managing matters of incontinence. And so you want to be able to find people who are really willing and able to participate. It can be helpful to think up, as Adrian was saying, thinking about those very specific tasks that you need help with and keeping that list for yourself. And then see if there are certain people that you can delegate those items on the list to. And talk with those people on your list. Be very specific about how you need help, when you need that help, and when you might need help in the future. If you start to build up that network or that support team earlier on, you can say like, right now I can handle it just fine on my own. But as the disease progresses, can you be somebody that I can count on to help with X, Y, Z? Um, don't take it personally if they can't help. Not everybody is really ready to take on a caregiving role. It's not to every person's strengths or skill sets to be in that caregiving role. I think it can actually be helpful to be grateful that somebody was honest and kind of told you that it's not something that they are able to take on, because what you don't want is to have someone take on that role and not be ready for it, not be willing to. It can lead to feelings of resentment or even safety issues potentially. And of course, show your appreciation to your support team. That'll keep them coming back, and can make the experience one that is really pleasant and can build a greater sense of connection between all of you. Um, so in this kind of point about caring for yourself, uh, you want to watch for warning signs of caregiver stress. There's many types of signs here, and it can vary from person to person. And it can be really hard to kind of see it in your own self. That can include things like denial that you're experiencing stress. People can become very angry or irritable. Some people become more socially withdrawn. That can involve becoming much more nervous or anxious about things. There can be a lot of rumination, like things kind of maybe looping your head a lot. You can become really exhausted and tired all the time. You can have difficulty with sleep. You can have a hard time focusing on things. But one of the things we really want to avoid is developing health problems in yourself as a result of taking on too much stress. The stress can lead to issues like blurred vision, irritable stomach, high blood pressure, changes in your appetite, sleeplessness. And so, in helping to take care of yourself, here's a couple things that can be helpful. One is to be realistic, understand kind of the losses that are going on, and really focus on enjoying the positive that are going on. Two is to know that you're doing your best. Everybody's really doing the best that they can, and it can be helped to have some compassion for yourself, just like you would have compassion for somebody else. So really think about what you would want what you would tell somebody who's in that caregiving role, and kind of be able to say that for yourself. So oftentimes we can be much harsher on ourselves in that internal voice, and really being compassionate with yourself can really make a difference. To know that you can't do everything all the time perfectly. um, Take care of your health, and that means making sure that you're visiting your healthcare provider regularly and that you're listening to your own body and its needs. And another big one is that mental health is health. So if you are experiencing issues of anxiety or depression or pretty frequent irritability, don't be afraid to reach out for professional help. Friends and family can certainly be there to support, but for more intense issues, you might kind of get to the limits of their skill set and their ability to help. And so, just like how you want to bring in a doctor or some other healthcare provider to help with a physical health issue, it can be helpful to have a mental health professional involved. And then lastly, take breaks for yourself whenever you can. We call this respite. Respite looks different at different times for different people. You can't do it all by yourself. Um, think about kind of how respite can look in different circumstances. Respite can look like having somebody come in and take your place for a few hours. It can look like somebody kind of covering you for a weekend. It can look like having a loved one be able to spend some time in an adult care program. But respite can also look like taking a shower and kind of being in that bathroom by yourself where people can't really interrupt you. That's also some respite. So really taking time to be really aware of when you are taking that moment for yourself. And here at Isaac Health, for those of you that are already working with us now, we're here to help you to get in touch with any additional resources that help you and provide access to caregiver support groups and other forms of respite care and more, just like with our partners with the Caregiver Action Network. So that's the talk that we had planned for today, but we'll now switch it over to question and answer. So I'm going to stop sharing here. So if you haven't already entered in some questions, please go ahead and enter into the Q&A section. We've already got some great questions here. So let's see. So one question I have here is, how does long-term care insurance play into helping to support caregivers, or kind of what is the role of long-term care? Can someone, maybe Marvell or Adrian, speak to that?
Sure, I can give it a first go. So, long-term care insurance, should you have access to that product, it varies greatly on the benefits that it provides, and so really it depends on the specific benefits of that insurance. But having said that, usually in cases where you're going to use that insurance, the provider that you're using the insurance with will be able to help navigate you to what that insurance is going to cover, whether that means it's in-home services, whether that means paying a per diem rate for residential care, whether that means supplies. It really can just depend on the plan itself. But if you do have a long-term care insurance policy, odds are, if you're a caregiver supporting someone with Alzheimer's or dementia or some other condition, chronic condition, that long-term care insurance policy is going to have some sort of benefit, but it really just depends on the policy itself. And so we encourage folks to look back at the policy, but also in the instances where you're going to use that policy, talk with that provider about ways that that plan can be utilized.
Great. Thank you, Marvell. Another question I see here. So I've been caring for my mother with dementia for the past 3 years, and lately I've been feeling really exhausted all the time. How do I know if this is burnout or just normal fatigue? And what should I do if it is burnout?
Yeah, I'll say real quick that caring for someone with Alzheimer's dementia for 3 years, that there's no way you're having a normal level of exhaustion and fatigue. That is it an abnormal amount of exhaustion and fatigue that we would unfortunately expect you to have. Adrian, I'll turn over to you for additional comments if you'd like.
I was going to say the same thing, Marvell. I think oftentimes caregivers move themselves to the back burner, right? So we say, oh, I've always been this tired. This is just normal. I don't want to make a mountain out of a molehill. And what I will say, I think, as anyone who supports caregivers would say, is we want you to make a mountain out of that molehill. You cannot pour from an empty cup. So if you're feeling exhausted and fatigued, we need you to take care of yourself. And so whether that's seeking outside respite, whether that's reaching out to get some support for you in terms of mental health support, joining a support group. And support groups can sometimes be intimidating. If you've never been to one, I want to put you at ease that they are the most diverse, exciting, compassionate group of people you're going to meet. And by exciting, I certainly don't mean like it's a party. What I mean is they want to help you. They are in the boat with you. And so oftentimes the resources they think of and the support network that they have already built is going to be such a gift that you didn't even know was out there. So you have professionals who can tell you what we can tell you, but when you're in a support group, especially a local support group with your peers, the things that they know are available to you will blow your mind. But if you're not able to get to one in person, online support groups are wonderful. There are a variety of them out there. They are a great space, safe space for you to get things off your chest, but also to ask questions. Is this normal? Is this feeling normal? Is this activity normal? Is this behavior normal? And sort of just discern what you want to escalate, but also sort of feel like you have a comrade, even if they're not in the house with you every day.
And actually, a relevant question just popped to here is, how do I find a local support group?
Yeah, so we at Caregiver Action Network can help with that. If you go to caregiveraction.org, we have a vast amount of resources, but also you can reach out to us. If you can see it here, our 855 number that you can call, or you can go online and web chat or even email us, and we can help you, depending on where your locality is, either direct you to local resources, direct you to your local area agency on aging, and help you, provide guidance on that. Because as Adrian said, there are many different types of support groups out there that may be a good fit for some and not for others. And so finding that good support system is really a great start.
Great. And one question here, maybe this is a good one for you, Adrienne, and I can also pitch in too, is can you briefly describe the guide program and its services?
Yeah, I'll let you take the role on that, Joelle, because I think Joelle will speak to it more eloquently than I could. But if you haven't explored the guide program, I will say this, it is still very new. And if you haven't had an opportunity to look into it and you are caring for someone with dementia, please take the time. It's a little bit of an investment up front in terms of appointments and making sure you've gotten everything together, but the benefits to the guide program are substantial. So if you're considering it and you haven't figured it out, give us a call. We will walk you through it here at Isaac to make sure you're in the right spot. But I'll let Joelle explain the details of guide.
Yeah, so GUIDE stands for Guiding an Improved Dementia Experience. So this is a program, as Adrian mentioned, is really, really new. I mean, it's been about a year. And this is a program that came out of the Center for Medicaid and Medicare Innovation Center. So this is primarily a Medicare program. And so what it involves is helping to provide a very kind of consistent care experience for people who are affected by Alzheimer's disease and related disorders at the level of dementia and their caregivers. This structure involves a comprehensive assessment, so it includes understanding kind of what level of impairment somebody has, what medical conditions and medications are involved. It also includes comprehensive kind of support services. So oftentimes care navigator. So having a dedicated care navigator that can help to provide training and education for caregivers and point you to those local community-based resources for additional supports, like finding support groups. It also involves having access to 24/7 access to support, so a 24/7 support line. It includes respite care. So that's one of the other really nice things about the guide program is it does include some respite cares, and that can be in the form of having like a home health aide or helping to cover the cost of an adult day program. And then the other piece of it is kind of doing comprehensive care planning. So just making sure that with the kind of medical provider and the rest of the care team, that you have a sense of kind of what is the condition that you have, what stage things are at, what to expect over time, and what to do in different situations that come up. And this whole team, this whole system is there to support you long term. It is all covered by Medicare, so it is at no cost to somebody who's in Medicare. The one exception is that it's a very specific program. So only people right now who are in traditional Medicare, meaning that they don't have Medicare Advantage, are eligible for it. It's also only for people who are not in things like a skilled nursing facility currently or in hospice care. I think if you're not sure whether you're eligible or not, you can find information about it online. You can also talk to us. We're always happy to talk about it and see if you might be eligible for the guide program. And even if you're not eligible for the guide program, we actually do have a whole suite of programs and services that can be covered by insurance to provide a lot of these supports. Um, the next question that came up, I think, is an important one as well, which is what ways can I get my husband to a program without telling him it is for Alzheimer's patients? He's been in denial and would be hesitant or aggressively against attending. He was diagnosed 10 years ago at age 58 and has more cognitive issues than physical, like eating or dressing. Would one of you want to take that one on?
I am happy to. That is a great question. And it's more common than you would probably imagine that this is a situation that caregivers find themselves in. They've located a resource, but now how do I get my loved one to buy into going to this? Because they probably don't acknowledge having Alzheimer's. And so how do we get them there? Do they need to know would be my first question. And the reason that I ask that question is lots of like adult day centers and support groups that are geared towards people with MCI or a dementia diagnosis won't put that in the title. They're really cautious about how they're branding things because this is so common. So you're not going to pull up to an adult day center, typically. You're not going to pull up to an adult day center that says, this is an adult day center for people with dementia. It's just not going to happen. If it does, let us know because we'd love to talk with them and provide some training and support on how we could rebrand that. But the reality is, if you call ahead and you say, these are my barriers to getting there, no matter where you're going, if it's a support group and it's a volunteer support group leader, or it's a paid professional at something like an adult day center, they're going to work with you on how to get into that building. So if the barrier is just getting into the building, know that. But the other thing I would consider is sometimes we utilize the helper model, which is that the person isn't going because they have dementia. They're going to help someone. They're going to help someone with dementia. They're volunteering their time to help the support group leader, to help the person. You're home. Let's get you up off the couch. The doctor says you got to do some more moving. So and so says it's good to socialize. The weather's gotten better. Whatever we're going to use to get them out of the house. And then we're going to be helping someone. So instead of it being about the person themselves, we're making them the helper in this scenario, which can often empower them to want to go with you to do the thing. I'm sure Marvell or Joelle have something to add to that.
No, I mean, just in the sense of recognizing, it really, you have to meet the person where they are and understanding, what needs they may have. And sometimes it's trying something out, and recognizing that, because your loved one's cognition is changing because they are changing themselves, that, something that may work initially may be more difficult later on, or vice versa. And so just recognizing that there are a variety of programs out there for a reason. And it's because, really there's a different fit for different types of individuals.
Yeah, I think one thing that I'll add to that as well is this point about people being in denial about their condition. I think that's a hard one because it can cause a lot of frustration. I think it could sometimes be helpful from a neurological perspective to be able to say that it may not actually be denial. It may actually be the condition itself. So these conditions affect your brain's way of functioning day to day, and it includes your brain's ability to notice what's going on with how you're functioning in your day to day. There's a term that we use called insight. So some people may actually not have insight into their symptoms. So it may not be that they're choosing not to acknowledge them. It may just be that their brain just not currently isn't equipped to be able to even register that those changes are going on, which can make it really, really challenging to manage these things, which is one of the reasons why we really do encourage people to can get involved in their care as early on as possible while they still have insight, so that way they can really be an active participant in deciding, this is what I want done, when the disease gets to such and such place, so that we all know that we're all acting within the person's best kind of interest, within their values, and help to preserve their dignity. Another question I see here is, sometimes I feel guilty taking time for myself, even something small like going for a walk. How can I give myself permission to prioritize my own needs without feeling selfish?
Yeah, that is a really great question. And the first response I'll give is that you deserve it. You absolutely deserve to have that space and that time. And and it's not deserving because of everything that you've done as a caregiver. It's deserving because you're a human being that has needs that really must be met. Because without that, as we've said before, your cup starts to drain, or you haven't put on your oxygen mask before you've helped the other person. Any metaphor you'd like to use, but recognizing that you know guilt is a natural feeling that you're going to have, and and what we share, folks, is that sometimes you do have to kind of push through it and recognize that you may feel that way, but it doesn't mean that you should deny yourself that access to that alone time or self-care or just taking a walk, because frankly, taking a walk is a small amount of time, and if you can have the space to do it, it can do wonders for your own mental health. But just recognizing that, yes, the guilt may come there, but also knowing that you deserve, regardless of anything that you've done as a caregiver that day, that week, that month, that you deserve that time.
Absolutely.
And
I
I'll
think
mention, it's just that support groups can also be a part of that as well. We have a Facebook group that you can join, Caregiver Action Network, with over 2,000 individuals that support each other in this way through posts and through threads that say, hey, an accountability partner is like, did you take that walk today like you said you were going to take every day or every Wednesday? So that individuals, that sometimes having that external validation can be helpful as well. Sorry, Adrianne, I jumped back in before.
No, I love that. I think something that we hear often from caregivers is that they can't find the time for it in the day. And so I was just going to say it's important to schedule it, just like you would schedule a doctor's appointment or any other ancillary service, whether it's physical therapy or a dentist visit, you need to schedule time to take care of yourself. So take a look at your calendar. I challenge you to do that tonight. Hop off this call, take a look at your calendar. What do you have in the next week, in the next month, in the next 3 months? Something for you, but also something that you're looking forward to. So if you have a dentist appointment, we're not going to count that as self-care because that probably isn't something you're looking forward to. So schedule yourself something to look forward to, because that can give us something at the end of a long day. We can take pause and say, okay, today, every day is only 24 hours, and today was a long 24 hours, but in 3 days, I get to go to lunch with friends, and I'm looking forward to that. So giving ourselves something to look forward to, but scheduling it so that we aren't a negotiable. We're taking care of ourselves, and that is on the calendar, just like everything else that matters.
Wonderful. Another question here I see is, are there any specific coping strategies when dealing with personality changes? And I think we see this a lot, people becoming much more irritable, there's people just really having a short fuse. We also see people becoming more withdrawn, like people who are like the life of the party, really chatty, suddenly becoming very quiet and really withdrawn. Any advice that either of you have for that?
So Joel said earlier, and I think it's an important thing to remember, that the person that you love who is living with dementia is experiencing dementia differently than you are. So their brain is changing. And while you're witnessing that from the outside, experiencing that inside the picture is incredibly challenging. So meeting them where they're at, going along to get along is important. So if someone's becoming increasingly more agitated or aggressive or combative, your partner has always been a go with the flow person, and all of a sudden everything you say turns into a fight. I would encourage you to go along to get along. What do I need to do now in this moment to get us to the next moment so that it doesn't feel overwhelming? But the opposite of that, the other side of that, which is that sometimes someone becomes more removed, can be incredibly challenging, right? If your loved one was the life of the party and now doesn't want to leave their recliner, that can be really disheartening to sort of watch that change. So something I would encourage you to do is to pull out a photo album. Pull out your phone, look through some of those old memories with the person. Sometimes that can help us to kickstart some other feelings or emotions. And music does an incredible thing no matter what mood folks are in. Typically for individuals with dementia, if we can find a couple of songs from any genre at any point in their life that they can connect with, it can do us a world of good, whether it's trying to get somebody in or out of the bathtub or trying to get them to perk up from the couch or calm down after an argument. If you can find a couple of go-to songs, that can change the entire mood for someone. And it seems so simple, but literally just having those available to you, whether it's on a phone or a CD or whatever the case is, that can sort of change some of those moods in the moment.
And if you need some additional inspiration for music genres or types, there's been some really great research looking at bringing music from when your loved one was in their early 20s or like late teens can actually be quite powerful. So if you just like do the math, figure out what year that was, and pull up like the top 100 or the top 25 songs from that time, I think you can really see some almost like an emotional shift in the person. Um, one other question I see here is my wife needs 24/7 supervision and or companionship. If she is left alone for about 30 minutes, for example, while I, as a caregiver, am taking a telephone call or showering, she seems to get quite depressed. Are there any recommendations to deal with this?
Um, that is tough because I would imagine that you and your wife having a long relationship and that connection being there and that connection serving as a reassuring point for your spouse when perhaps she's a little bit confused, and then when that connection is even gone for a little bit, because for her it may not seem like 30 minutes, it may seem shorter, it may seem much longer, but recognizing that one, you do have to do those things, taking a shower, doing the other things as well, in ways to perhaps help mitigate her anxiety. back to some of the strategies we just talked about. Maybe there's a favorite TV show that she used to watch that you can maybe find on like some of the older cable channels, or even streaming on some of the platforms that maybe she can watch for that 30 minutes. Maybe there's music or things that can engage her in ways that that give her comfort in that moment. Or, there could be instances where perhaps there is a neighbor that can come over her a little bit, expanding your care circle so that it's not just you, but also just recognizing that there are going to be moments, no matter what, that come up like this, and being able to navigate them so that her needs are met really is important. But just recognizing that also, a loved one that is navigating Alzheimer's and dementia, there are going to be peaks and valleys. And so the fact that she may have some feelings of depression, that may not be always avoidable as well. And so having a plan that just looks to avoid that may not be as fruitful as trying to find ways to engage in other methods with your spouse. The other thing that
Well,
I'll mention is that going to our website, caregiveraction.org, we have a module we did a few months ago on managing through difficult challenges of communicating with someone with memory loss. I tried to put it in the chat, but I wasn't able to do that. But if you go to our website, you should be able to find it. Sorry, Adrian, go ahead.
oh, you're fine. I was just going to add to that that busy hands can often pass time more quickly. And this can be a task like literally a bottle of Windex, if that's still safe, and a rag to wash the back windows while you're taking a shower. It can be folding socks. You can walk into a store, buy a bunch of different colored socks, stick them in a laundry basket, and this can be a diversion tactic. Every time the phone rings, you can pull out the socks, start folding a couple of them, walk away with the implication that she might pick them up. It could be something like towels, which we all have laundry, right? So it can be some of those tasks that maybe she's been accustomed to doing over the years that will keep her hands busy for that 30 minutes while you're in the shower, so that the time doesn't feel like it's ticking on and on and on because she has something to do. Some folks find stuffing envelopes or cutting out certain things. It will depend where she's at, in terms of what's safe and appropriate, but finding something to keep her hands busy will likely buy you some time to get the things done that you want to or need to get done, while she can stay safe in a task, without counting down the seconds until you're back.
Great. And one question here that's come up, and I think this is one that's come up in quite a bit. I saw there was an article in AARP about this, but what about for people who don't want to become a caregiver? One question here is about kind of the role of things like long-term care insurance to help to avoid that possibility. But I think there's a bigger question about, like, what about people who really don't feel equipped or that they don't want to take on that caregiver role? Can either of you speak to that?
I don't think there's any shame in that. And I mean that genuinely. I think sometimes we just assume that people want to or can take on the capacity of being a caregiver. And that's not true for everyone. And that doesn't make you less of a person, less of a partner, less of a child, your role still stays intact, and it doesn't change the amount of love that you have for the person. But there's different varying degrees of caregiving. And so maybe you can't do the hands-on caregiving, but you can help to coordinate the care. Maybe you can't do either of those things. The reality is building that network of support early on is going to be incredibly helpful. Who do you know that has excelled in this? Who do you know in your personal life or your professional life who has been a caregiver in a personal setting, who has cared for a family member, and how can they help you to build that network or provide some guidance there? But also, who do you know that would be willing to step in, and what could they do? How could you help to divvy up some of these tasks so they're still getting done without you feeling like they're all on your chest?
Great. Well, I think that's all the time we have for questions. We're at time. So I just wanted to say thank you everyone for joining us today. If you have any additional questions or need further resources, don't hesitate to reach out to Isaac Health or the Caregiver Action Network. We're all here to help to support. We'll also be sharing some resources from our partner organization, the Caregiver Action Network, after the webinar. And again, a huge thank you to Adrianne and Marvell for joining us today. Your insights have been so invaluable. And to everybody who joined us tonight, take care, and we look forward to seeing you at our next session. Take care.
Thanks so much, everyone.